It's another day with the physicians where your health is our business. With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what you know is
You're welcome back to the Planning Author of your regular program.
The summary is that if you catch prostate cancer very early, what would normally term stage 1, then survival, 5-year survival rate is about 90-something%.
Wow. Monkeypox is a rare disease that is caused by infection with monkeypox virus. Monkeypox is a viral zoonosis. That is, it's a virus transmitted to humans from animals with symptoms similar to those seen in the past in smallpox patients. Although it is clinically less severe, with the eradication of smallpox in 1990 and subsequent cessation of smallpox vaccination, monkeypox has emerged as the most important orthopox virus for public health. Monkeypox primarily occurs in Central and West Africa, often in proximity to tropical rainforests, and it has been increasingly appearing in urban areas. Even in our own country, Nigeria, it's been reported that we have monkeypox now in our environment. Monkeypox was actually first discovered in 1958 when 2 outbreaks of a pox-like disease occurred in colonies of monkeys that were kept for research, hence the name monkeypox. But the first human case of monkeypox virus was recorded in 1970 in the Democratic Republic of Congo during a period of intensified efforts to eliminate smallpox. So since then, monkeypox has been reported in people in several other Central and Western African countries. Since May 13, 2022, cases of monkeypox have been reported to WHO from 12 member states that are actually not endemic for monkeypox virus across 3 WHO regions. On your regular TV health talk show, The Physicians, we'll be discussing monkeypox, the causes, the symptoms, diagnosis, prevention, and of course, management. Stay tuned. It's another day with the physicians where your health is our business. It's always very exciting knowing that I'm available to always talk about health on your program, The Physicians, and knowing that you are always there waiting to get more information that has to do with health. My name is Dr. Martina Agbere, And with me in the studio, we have our guest. He is a consultant public health physician and also a senior lecturer at the College of Medicine, University of Lagos. She is Dr. Oluchi-Kanma Okafor. Doctor, you're welcome to our program.
Thank you. Thanks for having me.
So let's just go down to what we have today. We have talking about monkeypox. It's not something that is actually very common, but it's something that is of public health interest. And of recent, we'll be talking about it in our own country, Nigeria, even other countries that there is not endemic to having monkeypox. But of recent, they just announced that we have had a death on about somebody who died from the monkeypox. So it means we need to create more awareness. So let's talk about monkeypox. What actually is monkeypox?
Yeah. So monkeypox is a viral infection caused by the monkeypox virus.
Okay.
So this virus occurs in the same, genus as viruses that we may have heard in the past about cowpox and, smallpox.
Okay.
But it has not reached human infection over the years. But like you identified in 1958, sometime there, it was identified among a population of monkeys that were there for research.
Okay.
But going on, a couple of years later, it was found among humans.
Okay.
And these were in the Democratic Republic of Congo.
Okay.
And over the years, in several countries in Western Africa, monkeypox has found to occur. Countries like Central African Republic and Nigeria,
Okay.
along with the DRC, are known to be endemic
Okay.
for monkeypox.
Okay.
And why it's of concern now is that in the past couple of years, I think 2013, 2020, other countries over the world are seeing these occurrences. Twice it has occurred in the US, and they were traced to Nigeria.
The ones that
Yes,
happened
because they arrived there through a traveler.
Okay.
But in both cases, it didn't spread because it was immediately contained.
Okay.
Those who were contacts of this traveler were told to isolate and watch themselves, but there were no fatalities. But in the currently, we're having a monkeypox occur in several European countries. About 12 European countries have reported
cases
of monkeypox right
Okay.
now. Even in Nigeria, we've had 21 cases to date. As of yesterday, we recorded 21 cases and one death.
One death.
So it's not a very fatal disease, but deaths do occur.
Is there a particular time where you have an upsurge of the monkeypox virus?
Well, I haven't heard of any seasonality associated with it, but it's endemic in Nigeria, so it can occur at any time.
Okay.
Interestingly, the symptoms are just like the other viruses, non-specific. So things like fever, malaise, you're just feeling unwell, headaches. Then, after a couple of days, if it were to be monkeypox, the rash would appear.
Okay.
So the rash are typically pustular.
Okay.
And if you observe the rash, it has a gradation. So first of all, there's a pustule, it might have get a scab on it, seem to dry out, then it will seem to ooze out something, then it will seem to be present for a while, then dry up again, then disappear. So it has a typical appearance, and these pustules are all over the body.
Okay.
So they first start maybe in the trunk,
Okay.
the head, and then it spreads around the body. So the important thing is for doctors, physicians, those that care for people that are in the position to receive those who are ill, to have a high index of suspicion. Just look out for it.
Okay.
Yes, but there's no call to be worried or anything, because the methods of control are just like every other virus. Okay. Hygiene.
Okay. Is there any particular age group that usually affects more? The elderly, the young ones, or those that actually have a low immune system?
Well, from the mode of transmission,
Okay.
it spreads from one affected person to another when the person comes in contact with the person that already has the infection.
Okay.
Either their body fluids or the fluids from one of the pustules, or any maybe clothing or material that has been in contact with them. And so one has to be in contact with the person that has the infection already. And so it usually will occur with somebody who maybe is not cautious. So maybe children, young people,
Okay.
they might be more vulnerable. But particularly of importance are people that have compromised immunity.
Okay.
So people with HIV, people that are on already immune compromising drugs that helps to reduce their immunity. Maybe they're taking cancer treatments, and people that generally have a poor immunity. So the important thing is if people are healthy, like we've often talk about, place a premium on your health. If they eat healthy, exercise, maintain good health, they should be able to avoid this infection.
You talked about that we lost a patient in Nigeria. We had somebody who had the monkeypox virus who actually died. Okay, so it means it can actually lead to death too. What do you think was responsible? Could it be? Does it affect other organs like the respiratory system, the cardiovascular system? Because we know very well that when during the COVID-19 period, it was more of a respiratory thing that was infection, but the respiratory system was mainly affected. But so how about this monkeypox? Why do you think that person died?
Well, as
Could there have been some
other
complications?
Yeah, probably. There probably were complications because you find that people that would succumb are usually people that already have an ongoing infection. So that's why priority treatment to be given to somebody who has monkeypox and has another infection. For example, another skin infection or cardiovascular infection, or in somebody who already has an ongoing health condition that has warranted hospitalization.
Okay.
So that person's health would probably already have been a little poorly for the person to have succumbed to the point of death.
So how is the diagnosis of monkeypox made from it when you see a patient?
Like I said, maintain a high index of suspicion. The symptoms are usually just non-specific. But by the time you see the rash, just viewing, you'll be able to identify the individual that's having the virus. And then some laboratory tests can be carried out to know. But the important thing is that if a person comes with symptoms that are suggestive, especially now that it's ongoing, to maintain that suspicion and treat accordingly.
Okay.
So for the health worker, maintain that barrier, protect yourself.
Okay.
I think that should go for any health worker now, treating any infection at all. Okay. Protect yourself, because that person might end up being a case.
Okay, so let's bring it down. For people that, family, probably somebody has monkeypox at home, how would you care for that patient at home?
First of all, the symptoms would appear like that of any other infection. So the person will have fever, might have headaches, might have abdominal pain, might feel weak, might need to rest a lot. Anyone who has that kind of presentation should be treated with concern. Let the person see a health worker so that they can get the best kind of care. So if there were to be another infection, that we get treated. If maybe the person is dehydrated, that would be attended to. If the person is malnourished, that would be attended to. But I would say let everyone who is ill get professional care.
Okay. Do you think they will require hospitalization?
Not usually.
Okay.
But like I said, it's that person who has an already present infection that might require a hospitalization. Typically, the patient does not require hospitalization. But when you identify the virus present with a person who has already reasons to be in hospital, so has an already acute medical condition that has placed them in hospital, so that person will be already hospitalized. But typically, it doesn't lead to hospitalization except the person's health condition is already compromised.
Okay. So how do you manage those patients?
Well, is it in the hospital?
In the hospital. Okay,
well, there are different methods. First of all, supportive care. Resuscitation, let the person be stable. After that, the next thing is there are different antiviral drugs that are no treatment is specific for monkeypox, but there are antiviral drugs that have been tried, they've been tested. Some of them are still under investigation for treatment of monkeypox. So as much as possible, with the discretion of whoever is treating, if those are available, it's a good idea to use them. But there's also a vaccine. There's also been tested, it's been examined for the purpose of monkeypox. So that can also be explored.
Okay, so there is a vaccine.
There is a
But
vaccine.
if it's not very common, do you really think that the vaccine is necessary?
That's the thing.
Because you don't know the people that it's not really common, it's a rare disease, so you can't ask people to go take the monkeypox vaccine.
But I don't think it's to have there's a vaccine that can, for example, if there were to be an outbreak,
Yes,
or if
okay.
a person had contact with a person who is diagnosed with monkeypox,
Okay.
there's a vaccine for people to use. So
Okay.
a vaccine has been developed and is still being tested, being tried, being looked closely at.
Okay.
Yeah.
So now let's talk about prevention.
Yeah.
We see the same basic ways
Basic.
of viral diseases. So
Yes.
let's break it down. What do you
So-
expect people to do?
Yes, right now we're talking about monkeypox in Nigeria. It's the first thing is to don't panic, don't get alarmed, and start to think of what to drink or what to swallow and all that. That's not the thing to do. First thing is to get informed, learn about the virus. What's it about? What do I need to do? And what do we as individuals need to do? Basic things, because of how it transmits. Hand washing,
Okay.
so important. Personal hygiene, so important. Maintaining a good level of health, having adequate nutrition, then being careful with oneself, personal care. If you're ill, seek the help of a professional.
If
Don't
you
go to
are
quacks.
ill, seek the help of a healthcare professional. When we come back, we'll continue from there. I'm sure you're hearing what you just heard, all that our consultant has told us about monkeypox. We want to also hear from you. Have you ever heard of monkeypox? It's not chicken pox. It's not smallpox. I'm talking about monkeypox. Let's hear from you out there what you have to say about monkeypox, what you know about it. If you've never heard about it before, what do you think is responsible for monkeypox? We'll be back after the short break. Stay tuned.
Yes, I've heard of it.
I don't really know much about it, but I've heard about it.
Yes, I've heard of monkeypox before.
What I can say is, when you as a person, you're staying near someone that is infected with the disease, it could make you have the disease. And also, if you are eating animals that are infected, it could also make you have that same diseases.
I think they say it has to do with eating bush meats or something like that.
It is transmitted through the skin or through animal. That's what I know.
No, I haven't, but I've seen some people having it online. I've seen how it affect them. Some they have the swollen body and some other things.
In real life, I haven't, but I've seen online.
Virtually, I've seen them online, the picture of how it is, but physically, I've not seen. It's like rashes. It has a boil on their body. It's a skin infection, something like that.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. We've been discussing monkeypox, the causes, the presentation, the symptoms, and management. And in the studio, we have Dr. Oluchi-Kanma Okafor. She is a consultant public health physician and also a senior lecturer at the College of Medicine, University of Lagos. She's been talking so much about monkeypox, and of course that is her field of expertise also as a public health physician. Dr. Kanma, we're talking about the prevention, how people can actually prevent it, and it still brings us to the same ways of preventing viral infections. You talked about not panicking. First, that is very, very important, because I can assure you that when one panics, okay, a lot of things actually now come with it. It's even worse, and that brings fear. It's now worse than managing the disease itself. And you also talk about washing of hands and keeping personal hygiene. Is there anything more you want to tell us about preventing one from having monkeypox, apart from the vaccine?
Yes, I want to just stress a little bit about information.
Okay.
Having the right information, because in the last couple of days, there's a little bit of a buzz. People are getting worried. People are getting scared. Someone is saying, should children be going to school? Should we, begin to apply our face masks again?
Okay.
Information. If we have the right information, we'll understand how the virus is spread. And having this understanding of how the virus is spread would inform what we do. I'd just like to reiterate that it is spread by the body fluids or fluids from or secretions from the pustules on the affected person. So that means an individual needs to come in contact with that person, or come in contact with the. It is said to spread, to have its hosts in the African rat. It is said to the African rat or other primates outside of man, like the monkey.
Okay.
So to avoid wildlife of that to that extent, avoid being in touch with.
Because someone will tell you, doesn't mean that we don't shouldn't eat monkeys anymore. Because I know some people eat monkeys.
Yes, some people eat monkeys, but it's probably prepared that very well.
Wow.
Because it is from the secretions of the live monkey, not the monkey as well. So I can't.
So all the monkeys have it normally.
I don't. I can't say every. No, it's not every monkey that has monkeypox.
Okay.
Remember that it originated from a group of monkeys in a lab somewhere in DRC Congo.
Yeah.
So it's not every monkey that has monkeypox, but we can't go diagnosing every monkey. So maybe apply precautions when you have to handle the African rodents or the monkey. Wash hands, wear protective equipment for those who have to work with them, like veterinarians.
Okay.
They have to work, or lab personnel. Apply the right kind of protection to attend to them, and then keep hygiene. Maintain a very good level of hygiene. And I want to say also household hygiene. So if you can keep rats at bay from your household, or keep people from coming in contact with rats, I think that's a good one. So we need to begin to apply measures to have cleaner homes, cleaner environments.
Okay. Oh wow, that is very enlightening. So before I let you go, for us in Nigeria here, we've had cases of monkeypox, and you also mentioned that someone died. What do you think people should do at this moment? Just coming out from the pandemic, and you are now hearing about monkeypox. You have said we should not be scared, they should not be alarmed. You try to allay anxiety. So what do you want to tell, final word to our viewers?
Yeah.
Final words.
So from where we're coming from, the pandemic where we're coming from, we've come to see that infections abound in our environment, and we're no longer alien to the fact that sometimes infections can become overwhelming, that they will cross borders. So let's just be cautious. Let's just take precaution to adhere to measures that are already laid down for infection prevention and control. Let's maintain a good level of personal care. Prioritize your health. Be healthy, eat right, exercise, ensure that your health is optimum, and then other measures like personal hygiene, hand washing, personal care. I think with these measures we'll be fine. Thank you.
Thank you very much, Dr. Oluchi-Kanma Okafor. And you've actually done well with discussing and telling our viewers out there about monkeypox. You have passed vital information to them out there. Thank you so much. And I hope when next we call on you, you'll also avail us your time. And to our viewers out there, we'll just have to call it a day for now. We'll be talking about monkeypox, the causes, the symptoms, the prevention, and of course the management. One thing you have to know is you have to keep healthy. You have to be very, very healthy, try as much as possible to keep personal hygiene. It's important. Wash your hand as often as you can, especially for those people that handle these monkeys around and rodents. You have to be very careful, and if you suspect that someone has it in your house, just seek medical attention. Go to the hospital. The rashes are very classical. I'm sure you will see them very, very classical. They're a bit big on the body, and it can be very inconveniencing also. Again, I want to say thank you so much for being part of our program today. Remember to follow us on our social media platforms, on Facebook, on YouTube, and on Instagram. And if you also want to be part of our program, just send us an email and we'll invite you. My name is Dr. Martina Agberian. Till next time, stay blessed.
Oriago, a mother of a child on the spectrum. Autism spectrum disorders is not a disease, is not a curse. If you've received the diagnosis of autism, there are things that you can do. Early intervention is key. As you process that, please be patient, love your children, and discover the talents that the child has in them, and watch them blossom. Keep watching The Physicians. Thank you for having me.